My name's CJ. Welcome to Discourse 300 Persuasive Speech. Today I'm gonna talk about universal and affordable healthcare. The main purpose of my speech is to persuade the audience to champion for affordable healthcare. Healthcare, as we all know, that healthcare is one of the basic and fundamental human needs. There has been an increase in the cost of healthcare services. There's an urgent need to champion for reduction in this cost and make health affordable and accessible. Uh, let's take for example our lives are full of activities ranging from work to school, ranging from travel, staying at home, uh, reading or eating, sleeping, or having fun. These activities puts our lives at risk. Um, can you imagine living without health insurance? What forms of uncertainties will be crisscrossing your minds, even when you catch a mild cold, or if your friend is sick, or your relatives, your parents, or your child? Can you imagine that 28.5 million people did not have health insurance at any point in 2017? That's according to United States Census Bureau. Well, the 28.5 million figures are alarming, and there is need for extensive, affordable, and comprehensive health care. Uh, why did I choose this topic? As we all know that healthcare is a basic right, and it is not a choice. Health care prices have been skyrocketing at an alarming rate, and this has led to drop in the number of insured people. There is need to have a universal and affordable health care. A recent study from Johns Hopkins indicates that about 250,000 people die annually due to medical errors. These numbers calls for immediate attention to healthcare policy, not only policy, but healthcare sector at large. Uh, Healthcare is one of the basic and fundamental human needs. There's an urgent, there's been an increase in the cost of healthcare services. There's an urgent need to champion for affordable and accessible healthcare. uh, my statistical facts from United States Census Bureau speaks louder than any other statements. Healthcare is a major issue in the public debates, be it on the media or public forums, be it in school, be it in churches, or be it at workplace. I have studied existing healthcare policies, got opinion from public, friends, got opinion from my college mates and my workmates on reforms that we need on the health sector. Today, I'm gonna discuss much about healthcare. Secondly, I will discuss about Affordable Care Act, commonly known as Obamacare. And third, I'll discuss impacts of Affordable Care Act. And last but not least, I'll discuss about coverage statistics and what needs to be done to reduce the numbers of uninsured people. Uh, Health care is one of the basic and fundamental human needs. There has been an upsurge in the cost of health care services. There is an urgent need to champion for affordable health care. Let's We've known what healthcare is. It's a basic human need and is recognized globally as one of the fundamental human needs. Uh, Affordable healthcare should not be a choice, but rather a requirement. Um, Health law professor George Timothy in 2018 issued on health care in the United States and the Affordable Care Act noted that um, the right to healthcare is widely recognized as a universal human right. Now that we've known what health care, we've known that healthcare is not a choice but a universally recognized right. I will now discuss uh, about Affordable Care Act. Uh, the Affordable Care Act, first of all, is a bill that was introduced by Congress in 2010 and was signed into law by the then President Barack Obama in March of 2010. Uh, Affordable Care Act aims at reaching each uninsured individuals by offering subsidies to low-income earners. Let's have a look at the impacts of Affordable Care Act. Affordable Care Act has been a right step towards achieving quality, affordable, and accessible health care. Over quite a long time, a lot of minority communities had been discriminated against in terms of getting quality care at affordable price. It doesn't only affect the minority communities but also the lower income earners. As seen in Kentucky, for example, Affordable Care Acts brought harmony to community and broke the race barriers. Uh, as Dr. Lynn Collin and Giovanni in July 2018 article in Examination of Health Insurance Disparities since in Kentucky since implementation of Affordable Care Act found out that Affordable Care Act lowered down an insurance rate in Kentucky and eliminated disparities. That's a plus to changes brought to healthcare. Having an affordable health insurance means a healthy and a productive nation. Investing in healthcare sector brings boost to economy. Dr. Robert Cooper and Dr. Lisa Gardner in August of 2016 issue on extensive changes and major challenges encountered in health insurance markets under the Affordable Care Act argue that affordable and quality health care positively influences health outcomes. Now that we've studied about basic human right of healthcare and what the uh, Affordable Care Act has done, I will now discuss what needs to be done to reduce the numbers of uninsured people. Uh, According to United States Census Bureau report of September 2018, about 28.5 million people in the United States did not have any health insurance at any point in 2017. These figures are alarming. Uh, Insurance coverage helps save lives by encouraging early detection and prevention of dangerous medical conditions. According to a 2014 study, the Affordable Care Act likely prevented an estimated 50,000 preventable patient deaths from 2010 to 2013. Uh, City University Public Health Professor David Himiston and Stevie wrote in January 2017 that a rollback or changes of the Affordable Care Act Medicaid expansion alone would cause an estimated for the 3,956 deaths annually. The government needs to put more finances for civic education that aims at encouraging people to enroll for insurance coverage. Next, there should be equal focus on quality and not affordability alone. Also, resources must be added to include training of more personnel to meet the current shortage in the healthcare sector. Now, let's summarize what we covered today. First, we discussed about the healthcare. We look at the Affordable Healthcare Act, impacts of Affordable Care Act, and finally, we discussed what needs to be done to reduce the number of uninsured people. Um, in conclusion, effective measures must be put in place to supplement the efforts of Affordable Care Act. Measures that are aimed at healthcare quality and accessibility must be adopted.